Hello class, welcome to week 6, NSG 318, and this week we're going to be looking at drug classes affecting the autonomic nervous system, central nervous system, and peripheral nervous system. The objectives are: discuss the mechanism of action, indication for use, major adverse effects of selected drugs that affect the autonomic nervous system. ANS can be used as the abbreviation. Central nervous system, CNS, and peripheral nervous system, PNS. Objective number 2, discuss the role of alternative and complementary therapies for conditions of the ANS, CNS, and PNS. Objective number 3, identify client-related factors that influence the effects of drugs that affect the ANS, CNS, and PNS. Objective number 4, utilize pharmacology resources and drug guides to make appropriate decisions regarding nursing interventions for clients receiving drugs that affect the ANS, CNS, and PNS. And objective number 5, use the nursing process to determine safe care for a client who is receiving medications that affect the ANS, CNS, and PNS. I want to encourage you to review the objectives and try to formulate questions. So we're going to look at anti-seizure drugs. And anti-seizure drugs are given for seizures, so clients that have seizures or epilepsy. So we know that the seizure disorder is caused by abnormal electric discharges from the cerebral neurons. The characteristics of epilepsy is loss of consciousness, involuntary or uncontrolled movement, which can be upper and lower extremities. The cause is generally unknown, but there are secondary factors that can cause a seizure. And these include brain trauma or anoxia, infection, stroke, and they are isolated seizures that can be caused due to fever, especially in children. Electrolyte or acid-base imbalances, alcohol or drug use. So anti-seizure drugs, as the name implies, it is used to prevent seizures. So anti-seizure drugs, they help to stabilize the nerve cell membranes. They suppress abnormal electric impulses in the cerebral cortex, and they have specific types of action. 1, they suppress the sodium influx, and suppressing the sodium influx through the drug binding to the sodium channel when it is activated, which prolongs the channel inactivation and thereby prevents the neuron from firing. So one specific way that anti-seizure drugs work is to suppress the sodium influx. And by doing that, it prolongs the sodium channel inactivation, and thereby it prevents the neurons from firing. It also works by suppressing the calcium influx. And what it does is it prevents the electric current generated by the calcium ions from happening. So The suppression of the calcium influx prevents the electric current generated from the calcium ions. And then it enhances the action of GABA. GABA stands for gamma aminobutyric acid. And what it does is it increases the action of gamma, which inhibits neurotransmitters throughout the brain. So we're now going to look at dilantin, which is classified as an anticonvulsant. So the use of dilantin is to prevent tonic, clonic, and partial seizures and status epilepticus. The mode of action, it reduces the motor cortex activity by altering the iron transport. So what it does when it says altering the iron transport is that, as we just mentioned in the previous slide, it inhibits the sodium influx. In other words, it prevents sodium from moving into the cells. It stabilizes the cell membrane, reduces repetitive neuronic firing, and it limits seizures, because seizures are caused by excessive firing of the cerebral neurons. So what anticonvulsive drugs does is that it decreases or reduces the repetitive neuronic firing, and by doing that it limits seizures. Dilantin or phenytoin is a highly protein-bound drug. So what it means, it has a very high affinity for protein. Contraindications includes pregnant women, because it has a teratogenic effect on the fetus or baby. It can damage the baby. Persons that have hypersensitivity, heart block, or bradycardia, it is contraindicated. So what it means, it should not be given. Caution, you want to give with caution. If a person has hyponatremia, hypotension, hypoglycemia, or if they have any suicidal thoughts or ideation. If they have thyroid disease, they are alcoholics, they have diabetes mellitus, renal and hepatic impairment, and if they are Asian in culture. Because of their genetic makeup, you have to use this medication with caution. Some side effects include gingival hyperplasia. And what gingival hyperplasia is, it's the overgrowth of gums, and the gums can become very red and they bleed easily. Then you have nausea and vomiting, fatigue, headache, drowsiness, and dizziness. These are all the headaches, the drowsiness, dizziness. They are all common side effects. When this drug is being administered, you have to be extremely careful if it's given to an older adult, because we know that every system decreases, every system function decreases by 50%. So you find that there is decreased metabolism and the drug stays longer in the body and they can easily become toxic. And then with children, they give usually a little higher dose because they have a higher metabolism. So the doctors may order a little higher dose because of their higher metabolism. The drug is broken down quickly in children. This particular medication, serum levels is required. So serum level is required because from the serum level, you will know the therapeutic effect. And the normal serum level is 10 to 20 mcg per ml. So lab draws are required to know if the drug dose needs to be increased or decreased. So when they do a lab draw, it's to know the therapeutic level, the therapeutic plasma or serum level. And again, the normal level is 10 to 20 mcg per ml. Dilantin does have adverse reactions, and these adverse reactions includes leukopenia, hepatic impairment, depression, hyperglycemia, bradycardia, peripheral neuropathy, purple glove syndrome. Purple glove syndrome causes swelling, discoloration, and pain to the extremities. And sometimes it is so painful it may require amputation. If phenytoin or dilantin is used for a long-term basis, and it is used because once it is ordered, the patient or client has to take this medication every day as long as they live. So it's lifelong. Must be taken every day and preferably at the same time so that the therapeutic level can be maintained and prevent seizures. And again, the therapeutic level is 10 to 20 mcg per ml. It also has life-threatening effects. It can cause aplastic anemia, thrombocytopenia, Stevens-Johnson syndrome, hypotension, ventricular fibrillation, and suicidal ideation. Upon administration of this drug, it is recommended that we follow the nursing process. So you want to assess your patient first. You want to do an assessment. You will obtain a current health history, including drugs and herbs that are being used at home. And drugs includes prescribed and over-the-counter medication that is being taken presently. You also want to determine the renal and hepatic function, the lab values. So you want to review those prior to administering the medication. Nursing diagnosis: these patients are at risk for injuries and falls. Planning: when this drug is being given, it is expected that the seizure frequency will diminish, so they won't have a seizure as often as they did prior to the medication being administered. They will adhere to the anti-seizure drug therapy. Again, this medication has to be taken on every day for the rest of their lives, and preferably it is better to take it at the same time every day to prevent seizures and to maintain that therapeutic serum level. Side effects from phenytoin: they're usually minimal. It is also important to note that the effect of phenytoin or dilantin is decreased if the client is on folic acid, calcium, or any antacid. Hence, the importance of knowing exactly what medication is being taken by the patient presently. So it decreases. Phenytoin is the effect is decreased if it's taken with calcium or antacid or folic acid. And it also decreases, phenytoin also decreases the effect of anticoagulants. If it's a female client, it decreases the effects of oral contraceptives, and it is highly recommended that they use a backup contraceptive. It also decreases the effect of antihistamines and corticosteroids. And ginkgo, the CAM, may decrease the phenytoin effectiveness. So again, it is important to do a thorough assessment, know what drugs are being taken, whether they are prescribed or over the counter, what herbs are being used, because for example, ginkgo can decrease the phenytoin effect for a client. Nursing interventions. You're going to monitor the serum level because you want to know the therapeutic range. And monitor the serum drug level of anti-seizure drug to determine the therapeutic range. And again, the therapeutic range is 10 to 20 mcg per ml. So the only way you're going to know if the serum drug level is at the therapeutic range is to do lab draws. You want to warn the female because again it decreases the effectiveness of oral contraceptives so that they can use another backup method or another contraceptive. Use seizure precautions for patients at risk for seizures. So if you have a patient that you're taking care of, you may want to pull the side rails up and pat them because you don't want them to injure themselves. Determine if the client is receiving adequate nutrition, as anorexia, nausea, and vomiting, they are common side effects. Advise patient not to drive or perform any hazardous activities when they are initiating drug therapy. You can educate the patient that to prevent nausea and vomiting, they can take this medication with food or milk. And again, it's very important to emphasize that they should take it at the same time every day. So evaluation will include the effectiveness of the drug, if it's working, if seizures are frequent. Then you want to monitor for overdose. Initial signs and symptoms are nystagmus, which is a constant involuntary movement of the eyeball, ataxia, impaired coordination, and then as overdose, a later sign for overdose is hypotension, unresponsive pupils, and coma. So treatment for overdose include respiratory and circulatory support as well as hemodialysis. So it's important we have to keep monitoring. You don't want the medication to have an overdose effect. You want it to be maintained at a therapeutic level. Now we're going to move on to drugs for the neuromuscular disorder and muscle spasms. Muscle spasms can occur at any time. And muscle relaxants are used for muscle spasms, and it is used to reduce pain, increase range of motion. Muscle spasms have a sedative effect, and they should not be taken with barbiturates, narcotics, or alcohol. Some muscle relaxants can cause drug dependency, and again, they should not be taken with barbiturates, narcotics, or alcohol. So we're going to look at Flexeril today, and it's used for short-term treatment of muscle spasm. The mode of action, it relieves spasms through a central action, possibly at the brainstem level. Contraindications include cerebrovascular conditions like acute myocardial infarction, bradycardia, heart block, cardiac arrhythmias, high blood pressure, heart failure, endocrine disorders such as diabetes mellitus and hyperthyroidism. And then you have other disorders such as cerebral palsy, hypokalemia, paralytic ileus, and concurrent use with the MAOIs. Flexeril should be used with caution if the client has seizures, if they consume alcohol, if they have CNS depressants, glaucoma, BPH, urinary retention, hepatic disease, and if they are breastfeeding. Side effects, anticholinergic effects, arrhythmias, CNS effects, unpleasant taste, allergic reactions include adverse reactions, includes allergic reactions, angioedema, myocardial infarction, seizures, and ileus. Now we're going to look at antipsychotics and anxiolytics. Anxiety can be of two types. It could be primary and secondary. In primary, it is not caused by a medical condition or drug use. It is managed with short-term anxiolytics. So primary, it's not caused by any medical condition or drug use. And it's just temporary, it's very short-term. and it can be managed with short-term anxiolytics. Secondary, it is related to selective drug use, medical or psychiatric conditions. Medications are not usually given for secondary anxiety. It is important to note that most of us can go through some amount of anxiety. A certain amount of anxiety may make a person more alert and energetic. But when anxiety is excessive, it can be disabling. Major anxiolytics group is the benzodiazepine. It's a minor tranquilizing. It belongs to the minor tranquilizing group. Long-term use of anxiolytics is discouraged because a tolerance can be developed within weeks or months, depending on which drug is ordered. Some symptoms of severe anxiety attack, or what is also known as a panic attack, includes dyspnea, like a choking sensation. The client may complain of chest pain, heart palpitation, dizziness, faintness. They may be sweating, trembling, and shaking, and just fear of losing control. Before giving any anxiolytics, non-pharmacological measures should be used to decrease anxiety. And some of these include relaxation techniques, simple techniques like instructing the patient to take a deep breath and blow it out, to listen to soothing music, or just talking to the patient. And you can use touch, just gently touch their arm. So you want to try non-pharmacological measures first to try to reduce anxiety or decrease it. And also what can help is to get a group support system, family support system. So one of the medications that can be used for anxiety is lorazepam or Activan. It is classified as an anxiolytic and it belongs to the benzodiazepine group. So the use is to control anxiety and to treat status epilepticus, and it can also be used to induce sedation. It can also be used for insomnia, which is difficulty sleeping. The mode of action is it potentiates GABA effects by binding specifically to the benzodiazepine receptors and inhibiting the GABA neurotransmission. This drug is high protein bound, and if it is given IM intramuscularly, it has an onset of action 15 to 30 minutes. And if it is given intravenously, it has a very quick onset. So any medication that is given intravenously, you want to give it very slowly, especially Activan. It has a rapid onset. So it can be activated 1 to 3 minutes once given intravenously. It is recommended not to be prescribed for longer than 3 to 4 months. And after that, the effects or the patient builds up a tolerance to it. Side effects includes CNS effects, ataxia, amnesia, GI distress, and hallucination. Adverse effects: bradycardia, hypertension, and seizures. It also has life-threatening effects: suicidal ideation, NMS, respiratory depression. Ativan, once it is started, it cannot be just stopped. It has to be a gradual decrease. So every day the doses decrease over several days. If it is stopped abruptly, it can cause the patient to have withdrawal symptoms. So it is a drug, once it is given, it's a gradual decrease. And then it can over several days, and then it can be discontinued. So patient may show symptoms or have symptoms of developed slowness in 2 to 3 days, and it may last several weeks. So those are the withdrawal symptoms. And then it also includes tremor, agitation, nervousness, sweating, insomnia, anorexia, and muscle cramps. So again, once Ativan is started, it's not a drug that the patient can decide, I don't want to take anymore, and just stop it. It has to be gradually decreased over several days to prevent the withdrawal symptoms. So you want to do your assessment. You assess for any suicidal ideas. Obtain a history of the patient's anxiety reaction. How do they react when they're anxious? Determine the patient's support system. Nursing diagnosis: anxiety related to situational crisis, and non-compliance related to adverse effects of medication. In the plan, you want to include patients' anxiety and stress will be reduced once the medication is started. And then you want to observe. When a patient is on Ativan, you want to continuously observe them. So that may require additional assessment. Interventions: you observe for side effects of any anxiolytics, you monitor the vital signs, you encourage family support, and you want to advise the patient not to drive a motor vehicle or operate any dangerous equipment while taking anxiolytics, because sedation is a common side effect. And you want to warn the patient not to consume alcohol or any other CNS depressant while they're on this medication. And then you do your evaluation. So now we're going to look at antidepressants and mood stabilizers. We know depression can have genetic predisposition. So what it means is, if you have a family member that has a history especially if it's a close relative of depression. Because of your genetic makeup, it increases your risk. And then we have social and environmental factors that can contribute to a client being depressed. Pathophysiological theories: when the levels of the monoamine neurotransmitters is decreased, it can lead to depression. Some signs and symptoms include depressed mood. You don't want to talk to anybody, just want to be in a room locked up. Despair. And a lot of patients, they don't want to eat. So you find they lose a lot of weight, while other patients, they tend to gain more weight because when they're depressed, they eat more. Loss of interest in normal activities like combing their hair, taking a shower. They feel fatigue, they're unable to sleep. Inability to think or concentrate, and then they may have suicidal thoughts. Complementary and alternative therapy for depression, so ginkgo biloba and St. John's wort. You want to discontinue the use of herbal products 1 to 2 weeks before surgery because of the sedative effect, and then if they're going to have surgery, the anesthesiologist needs to know because of the type of medication that they may be using. It can have adverse effects. You want to check with a healthcare provider before taking any herbal treatment. It is important to make sure you let the client know, to let their provider be aware that they're taking herbal treatment for depression, because chances are some of the medications prescribed, it can interact with the herbal treatment. And do not take the herbal treatment with antidepressants, prescribed antidepressants. So it is important for them to update their. And you have the different groups. You have the tricyclic antidepressants, TCAs. Then you have selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, SNRIs. Then you have the atypical antidepressants, and you have the monoamine oxidase inhibitors, MAOIs. Action of the tricyclic antidepressants: they block the uptake of the neurotransmitters norepinephrine and serotonin in the brain. Then they have, it elevates the mood, increases interest in the ADS, activity of daily living, decreases insomnia, blocks the histamine receptors, which leads to sedation, and it blocks the cholinergic receptors, which leads to anticholinergic effect. So this drug is used for major depression, when everything else did not work. Interaction: alcohol and other CNS depressants, it potentiates the CNS depression. MAOIs may lead to toxic psychosis, and they can also end up with cardiotoxicity. And if the patient is on anti-thyroid drugs, it may increase dysrhythmias. Side effects include drowsiness, dizziness, blurred vision, dry mouth and eyes, GI distress. You can also have urinary retention, sexual dysfunction, weight gain, seizures, sleep-related behaviors, and they may also have suicidal ideation, orthostatic hypotension, and dysrhythmias. Action: it blocks the uptake of the neurotransmitter serotonin, and again it's used for major depression. So whenever anything else does not work, anxiety disorders, obsessive compulsive disorder, panic disorders, phobias, post-traumatic stress disorder, prevention of migraine headache, decrease premenstrual tension. And the drug that we're going to look at is Prozac, fluoxetine, and it's classified on the selective serotonin reuptake inhibitor. It is popular because it doesn't have like a sedative effect. It doesn't cause hypotension or any anticholinergic effects or cardiotoxicity. So it's a very popular drug. So Prozac, the use is to treat depression. It is also used to treat bipolar disorders, bulimia disorder, obsessive compulsive disorders, any panic disorder, and premenstrual dysphoric disorders. The mode of action: serotonin is increased in the nerve cells because of the blockage from nerve fibers. Contraindication: persons that have hypersensitivity, you do not want to give them Prozac. You want to use with caution for any myocardial infarction, and if they're taking any MAOIs, if they're dehydrated, breastfeeding, if they have suicidal thoughts, any liver disease, osteoporosis, glaucoma, seizure disorder, diabetes mellitus, if they're malnourished or on any anticoagulant therapy or having diarrhea. With caution. Some side effects include memory impairment, tremors, dry mouth, blurred vision, GI effects, and erectile dysfunction. A lot of males would just stop using Prozac because of the impotence that it can cause. Adverse effects: seizures, angioedema, hyponatremia, hypokalemia, hyperkalemia, hypoglycemia, dehydration, bleeding, osteoporosis. Life-threatening: Stevens-Johnson syndrome, hepatic dysfunction, and it can also cause thoughts. If someone is on Prozac, it's very important for you to know or to educate them about what foods can interact, food and CAMs can interact with Prozac. And these includes grapefruit juice. It can lead to toxicity. So if a client is on Prozac, you want to tell them not to take any grapefruit juice because it can lead to toxicity. Alcohol and CNS depressants, if on Prozac, and they should consume alcohol, it increases the effects of the central nervous system and respiratory depression. So Want to make sure that they are educated and should avoid taking alcohol. Aspirin, NSAIDs, and anticoagulants. What it does, it would increase bleeding. MAOIs and SSRIs, it increases the risk for serotonin syndrome. And then St. John's wort, it increases the risk of serotonin syndrome and increases the effects of hypoglycemia. SNRIs, serotonin norepinephrine reuptake inhibitors. It inhibits the reuptake of serotonin and norepinephrine, and it's used for major depression. It can also be used for generalized anxiety disorder and social anxiety disorder. So another drug that we're going to look at that is classified on the serotonin norepinephrine reuptake inhibitor, and it is used, the name of the drug is venlafaxine or Efezer. It's used to treat depression, generalized anxiety disorder, social anxiety disorder, and panic disorders. Mode of action, serotonin and norepinephrine are increased in the nerve cells due to blockage from nerve fibers. So side effects, it can cause CNS effects, euphoria, amnesia, anticholinergic effects, weakness, diarrhea, and anorexia. Adverse effects, tachycardia, seizure, high blood pressure, serotonin syndrome, life-threatening. Patient can have suicidal thoughts, NMS, and renal failure, Stevens-Johnson syndrome. Effects are, it's contraindicated if the client has hypersensitivity, and you want to use with cautions if they're already taking MOIs or any CNS depressants, any anticoagulant therapy, renal and hepatic impairment. So you want to check the labs before administration. If they're pregnant and if they're breastfeeding, if they have narrow angle glaucoma, seizures, hypokalemia, hyponatremia, hyperthyroidism, MI, myocardial infarction, or heart failure. Then it's also important to check or to educate your patient about food and CAMS interaction. Alcohol and any CNS depressant may cause an increased effect of this drug on the central nervous system. It can cause respiratory depression, and it can cause the blood pressure to become very low, hypotension. If they are on anticoagulants like aspirin, warfarin, heparin, it can cause increased bleeding. If they're taking any other SNRIs, it may increase the risk for NMS. MAOIs, it can cause a hypertensive crisis and eventually the person can die. And St. John's wort, if it's taken with that, it can cause serotonin syndrome. The action, the monoaxamine oxidase enzyme it inactivates the norepinephrine, dopamine, epinephrine, and serotonin. It is used for depression, not controlled by TCAs and second-generation antidepressants. Drug interaction is CNS stimulant, such as vasoconstrictors and cold medications containing phenylephrine and pseudoephedrine, can cause a hypertensive crisis when they're taking it with MAOI. Side effects includes agitation, restlessness, they are unable to sleep, anticholinergic effects, dry mouth, orthostatic hypotension, hypertensive crisis from thiamine interaction. And some foods that contain thiamine includes aged cheese, yogurt, coffee, chocolate, pickled foods, sausage, beer, and red wine. So like any other medication, you want to do your assessment. You're going to do your patient's baseline vital signs and wait for future comparison. You want to take the time to do a health history. You want to find out the depression episode, what brings it on, and what support system the patient has. You're going to assess their mental status, if they have any suicidal thoughts, and if they're on any drugs, if they consume alcohol, and if they are taking any herb or herbal teas. You want to do a baseline lab, so baseline labs, and those labs will include creatinine, BUN, ALT, and AST. So you want to check the renal and liver function. Nursing diagnosis, social isolation related to feelings of sadness, and then self-directed violence, they are at a risk for. Planning, once the medication is started, should decrease. Nursing interventions, you want to observe the vital signs. You want to observe the patient for signs of depression and monitor the vital signs. You want to monitor for drug-to-drug and food and drug interactions, and provide patient with a list of foods to avoid. You want to counsel or educate the patient against pregnancy because of the teratogenic effects this drug has on fetus or on babies. Caution patient not to consume alcohol or any other depressant concurrently. So take them together. And then evaluation, it's continuous. And some of the things that you have to evaluate for is that they can get very restless, akathisia, restlessness, trouble standing, pacing the floor, their feet is in constant motion. Then you have asthenia, where there is extreme weakness, and again with men, they have to educate them about erectile dysfunction. Some patients may also complain of dizziness, weakness, headaches. Some of them can have like sweating and increased heart rate and blood pressure. So again, You have to constantly evaluate these patients. You want to evaluate the effectiveness of the drug therapy regarding whether the client's depression is controlled or if it has ceased. And being in recommending a support system is very effective in the management of patients who go through depression. So I want to encourage you to read your textbooks and go over the slides, and please don't hesitate to reach out to the instructors with any questions or anything that may need clarification.